Hi guys, once again, welcome to Dr. BKM Institutes, and please subscribe the channel if you have not, and please press the bell icon so that you can get all these classes and you should be notified for the same. And please, we have just completed listening part A that I'm putting it at the end, and even on the right top, you can see right now that I will put it on the top and you can just click it. It will take you to the listening part A, which we have done today. Now we are just trying to sort this listening part C, and let's see how hard it would be or how easy it would be. So taking help of the online material that's there, and you can take any listening whatever you like. This is from OET 2.0 online classroom. Thankful to them that they created this listening. The best part in the listening part C, just like the listening part A, you will have now, rather than 30 seconds, you will have 90 seconds. Please understand they have given you this time to digest the topic, to digest your questions. Like, let me tell you what I mean by this. You hear an interview with the Tom Clark, a science expert. That is what is the difference in the listening part. Hey, you have patient doctor conversation, or a patient physiotherapist conversation, or a physio dental conversation. Oh, sorry, patient dentist conversation. But in the part C, you have lecture. That means he will be speaking continuously. There is no dialogue. Dialogue means two people are talking. There would be a monologue. Mono means single. A single person would be speaking. So it would be a lecture form. So you hear an interview with the Tom Clark, a science expert on the breakthrough in the breast cancer research. It's not necessary that you will always get monologue. There can be dialogue as well. But you have to focus what kind of question is this. In this, they are saying there is an interview. Again, there should be two people because interview means two people are getting engaged. So you hear an interview with the Tom Clark, a science expert on breakthrough in the breast cancer research. Now you have 90 seconds to read 37 to 42. This is the best time, best utilizing time. In these 90 seconds, what you're supposed to do is to learn everything. Am I audible, guys? Before I start this thing, I just want to know, guys, are you listening to me? Am I audible?
Yes, yes, yes.
Yes, sir.
Okay, great. So now if you will see, what does Dr. Clark say about the new technology? Only question is opinion of Dr. Clark. Like what they trick you in reading and listening in the part B or C, that there would be many people who would be giving opinion about the new technology. There can be two people giving opinion about the technology. But you have to catch this word new because there can be opinion about the old technology. So this is what I sometimes called are very important words, which I count them as adverbs itself. Even if they are not adverbs, they tell me that I have to talk about the new technology. So this word helps me to focus on the right line. So new word is very important, and Mr. Clark obviously is very important. Now, if I go to the second blank, then they will say, what does the study prove according to the speaker? So the first of all, read only the questions. Don't read the options because then you will be confused. Why would you like to have 4 into 6 questions, 24 statements in your head? You just want only 6 statements in your head, which is the most important, that is 6 questions. So first question, Mr. Clark, about new technology opinion. Second question, what does study prove according to the speaker? Now speaker is the word I should focus. And what does study prove? Second, study means research, study means articles, study means data, everything, whatever. Now third, what is the speaker's view on breast cancer tumor types? Just the speaker view on tumor types. Okay, cool. Then next, go to the next question. Why does the speaker advocate a more tailored approach? This word is very common. If you will listen, again, that is why I always say my channel. Sorry, it's not right to say my channel. Dr. BKM's channel is so important because even in the vocabulary, I have covered this word tailored 2 times at least. Tailored word is a very common word. Tailored word is used in English countries that if we are giving individual classes, like when we provide you classes, I say our classes are individual, one-on-one. That can also be called as these classes are customized. It also means that these classes are tailored. Tailored means according to a specific individual. Tailor word is a very common word, just like the customized word, according to the each customer, according to each customer. So why does speaker advocate a more tailored approach? That means why does speaker say that individual attention is important. That is what is the meaning. So this is a very important vocabulary word that you must know. How do the advanced test the doctor? How do the advanced test the doctors? This line is not good. How do the advanced test the doctor? There is something missing. What does Mr. Clark ask to be wary? Wary of is a kind of a negative word. That means what he wants you to be aware of. That means there should be something negative. The test will take more time. So this is an active statement. So most probably A can be my answer. The clinical study has been performed already. Not that negative. Newly diagnosed women can participate in it. So I think otherwise the negative statement seems to be A more time. Generally, if I cannot find anything, I will do A rather than doing nothing. So small things, guys, again, small things give you huge, getting 313 listening, this small attention awareness can take you easily to 370 without even doing anything. It just requires that focus and awareness. So one example of this, you should know there should be a negative thing. Why does Mr. Now I have got 6 statements. Clark opinion, then second question was about speaker, third question was about speaker, fourth question was about speaker, then fifth question was about doctor's advancement test, and fifth question was about Mr. Clark again. So there are 2 people, Mr. Clark and speaker, and let's see how it goes. By the time it will start playing, but apart from the 6 questions, I need to do first 3 multiple choices as well. By the time they start, 90 seconds are good enough. They are beneficial for personalized care of the patients. They are tailored to the requirements of the patient. It redefines the spectrum of identifying varying diseases. Okay, so what does Mr. Clark say about the new research? Beneficial for the personalized care, tailored to the requirements. Now A and B option are almost same. Personalized care means tailored, but we have to understand the word beneficial and requirement. These are the 2 words. Otherwise, the rest of the blank is same. They are beneficial for the personalized care. They are tailored to the requirements of the patient. If the word beneficial is spoken, I will do A. If the word requirement is spoken, I will do B. Otherwise, C has the highest chance because A and B are almost same. So C should be the answer. Generally saying, because A and B are same. So C has the highest chance according to me. But let's see. Okay, let's see.
Staff को बुला.
Okay, I'm playing that. Sorry, I take it little forward and it will go like a flash. So everybody be attentive. Okay.
New genetic technologies are allowing scientists to do recent years to illustrate tissue and could provide more targeted treatment. Our science editor, Tom.
Just a second. I just want to make sure we get from the right place. Now it's okay.
Cancer is not one single disease, but actually 10 distinct types of tumor, dependent upon a woman's genetic makeup. That is the finding of the largest ever study of breast cancer tissue and could provide more targeted treatment. Our science editor, Tom Clark, is here to tell us more. Tom, it sounds dramatic.
Now, the first thing that you need to understand and to be aware of is a very easy thing. Whatever this person was saying, it's not important because my first question is about Clark. So when Clark will speak about the new technology, that's where I will focus. That is where I save energy. Saving energy is a very important skill, both in the reading and listening. You should know where to focus. Like in reading, you should know which data is important to focus. In the listening also, you should know which data is important to focus again.
10 different diseases, effectively. This study is one of the most sort of powerful in recent years to illustrate what new genetic technologies are allowing scientists to do in sort of redefining how they understand disease. And it's a big step towards this idea of tailoring disease treatment to the individual, this idea of personalized medicine, in this case, for breast cancer. Nowadays, today...
Sorry, We have to really listen to the voices. I
Study
got confused between the
Genetic
voices.
makeup. That is the finding of the largest ever study of breast cancer tissue and could provide more targeted treatment. Our science editor, Tom Clark, is here to tell us more. Tom, it sounds dramatic. 10 different diseases, effectively.
This study is one of the most sort of powerful in recent years to illustrate what new genetic technologies are allowing scientists to do in sort of redefining how they understand disease. And it's a big step towards this idea of tailoring disease treatment to the individual, this idea of personalized medicine, in this case, for breast cancer.
What do you say, guys?
C.
C is not the answer for sure, sir, because there was a word he said instead of redefining. Instead of redefining, that means new technology instead of redefining. So I will make you listen again. C is definitely not the answer, as far as I think. I just am confused. That is where elimination, this method is known as elimination, both in reading and listening. That's why I say elimination is the strongest method. Let's listen to it again. I will redefine things. Okay.
Disease. And it's a big step towards this idea of tailoring disease treatment. This study is one of the most sort of powerful in recent years to illustrate what new genetic technologies are allowing scientists to do in sort of redefining how they understand disease. And it's a big step towards this idea of tailoring disease treatment to the individual, this idea of personalized medicine, in this case, for breast cancer.
B. I think B.
So personalized medicine.
No, they are saying that instead of redefining, they are towards the tailored to the requirements of the patient, but not for the personalized care. So I think it looks like B.
Yeah, it should. What I'm saying, sir, C should not be the answer, but I feel 100%. And A and B, they were said something. He said something about the tailoring.
Tailoring, they said instead of personalized care.
Instead of, okay, let us
At the end. I think so.
let's try it again. Just one more.
Science editor Tom Clark is here to tell us more. Tom, it sounds dramatic. 10 different diseases, effectively.
This study is one of the most sort of powerful in recent years to illustrate what new genetic technologies are allowing scientists to do in sort of redefining how they understand disease. And it's a big step towards this idea of tailoring disease treatment to the individual, this idea of personalized medicine, in this case, for breast cancer.
Absolutely right, sir. So only
nowadays, today,
instead of personalized medicine for the patient, also he used the word personalized medicine. This personalized medicine word I could listen to the first time. I really wanted to eliminate anyhow, because personalized care is different from personalized medicine. That is also the word we should focus. So if you can listen to the word instead of in the part C, if you can eliminate. And if you can just listen to the word personalized medicine rather than care, then you can eliminate A as well easily. Let's do it last time, because I want to tell you how to do it. That is the most important thing. Let's listen again. Then ultimately we will reach to B automatically.
Our science editor Tom Clark is here to tell us more. Tom, it sounds dramatic. 10 different diseases, effectively.
This study is one of the most sort of powerful in recent years to illustrate what new genetic technologies are allowing scientists to do in sort of redefining how they understand disease. And it's a big step towards this idea of tailoring disease treatment to the individual, this idea of personalized medicine, in this case, for breast cancer.
Instead of personalized medicine in this case. So two words instead were important, like sir said. Obviously, sir is much better in this particular blank for sure. But again, there is one word that can be differentiated easily, that personalized medicine word was used rather than personalized care. So C you can eliminate, A you can eliminate, then ultimately you are left up with the B option. Then you come to the second question, then you immediately start. Please, even if your A is wrong, first is wrong, 37, you have to jump on to 38. Now, please, whatever it is right or wrong in the final exam, focus on 38 now. What does the study prove according to the speaker? Now, Clark's voice is not important. Speaker voice is important. By the time speaker will speak, you need to understand these three options. So I will try to read these three options. Again, according to us, generally, I'm not reading anything. I'm just telling you about OET. broadly should be eliminated, LY word. Possible word means maybe. Plausible means possible. This is also covered in our vocabulary. That's why I'm saying go through our videos. Then obviously respective word is also there. Respective always means, see guys, according to your respective qualification. If I say you according to your respective qualification means if you are a nurse, if you are a doctor, according to your respective qualification. In the same way, larger studies are possible for respective conditions. That means there would be different conditions. And that breast cancer falls broadly into 10 main genetic groups. This can be, but LY word is there. Treatment options for a specific condition can be mentioned. And specific word again is like respective. So both the word specific condition. Now I am confused between large studies or can be word obviously is a matter of choice. I always say can has the highest chances, but possible word is also means can or may because that means possible. We're just doing last two questions. Guys, please focus. Okay, let's see. Let's see what Rassi say.
Nowadays, today, at diagnosis, how serious a breast tumor is largely judged based on how well tests, how it responds to tests for the two particular breast cancer drugs that are available to treat the disease. And this study sort of turns all that on its head. It looked at 2,000 tumors from women in the UK and in Canada. It's the largest study of its kind. And what it found by looking at thousands of genetic mutations within those tumors is that, yes, breast cancer isn't one disease, but it falls into 10 very discrete genetic groups. And which genetic family the breast cancer belongs to has a strong bearing on how serious that tumor might be and how well it responds to treatment. For example, one class that they've identified, which according to current tests would be grouped as quite difficult to treat, in fact only has about a 10% mortality rate after 10 years, not such a severe type of cancer. Conversely, another group that they've identified, which would have a sort of fairly positive treatment profile based on current tests, would in fact has a 60% mortality after 10 years, a really nasty type of tumor. More interestingly, another new class that seems to belong to these very lucky group of women whose immune...
Generally, he's talking about groups. So I really believe he's in question number 39 rather than question number 38. Because he's talking about types. So again, keeping the next question in your mind is very important. What is the speaker's view on the present understanding of the treatment is flawed? Certain conditions have positive. It can ensure appropriate treatment. Let's see. Let's listen to it again. Again, it's a different listening. This kind of listening do not come in exam. But let's see it again.
And what it found by looking at thousands of genetic mutations within those disease treatment to the individual, this idea of personalized medicine, in this case for breast cancer. Nowadays, today, at diagnosis, how serious a breast tumor is largely judged based on how well tests, how it responds to tests for the two particular breast cancer drugs that are available to treat the disease. And this study sort of turns all that on its head. It looked at 2,000 tumors from women in the UK and in Canada. It's the largest study of its kind. And what it found by looking at thousands of genetic mutations within those tumors is that, yes, breast cancer isn't one disease, but it falls into 10 very discrete genetic groups. And which genetic family the breast cancer belongs to has a strong bearing on how serious that tumor might be and how well it responds to treatment. For example, one class that they've identified, which according to current tests would be grouped as quite difficult to treat, in fact only has about a 10% mortality rate after 10 years, not such a severe type of cancer. Conversely, another group that they've identified, which...
So again, it's a very difficult blend, but ultimately if I have to do it, the only thing I can do is B, because he was talking about large group of studies, right? He was talking about 2,000 women who were studied, I guess. Then he did not talk about anything about the treatment course, that there can be a particular treatment course that can be mentioned. So there was nothing about the specific condition. And breast cancer, 10 word also was not used. Again, there, see, I have to eliminate when I don't know what to do. First thing, treatment course for a specific condition was not mentioned. Second thing, in the C part, 10 main genetic groups were not mentioned. Let's listen to it again, like whether he has spoken the word 10 or a specific treatment course. Just once more.
Drugs that are available to treat the disease. And this study sort of turns all that on its, on how well tests, how it responds to tests for the two particular breast cancer drugs that are available to treat the disease. And this study sort of turns all that on its head. It looked at 2,000 tumours from women in the UK.
So that is where I say 2,000 means obviously it was a large study.
It's the largest study of its kind. And what it found by looking at thousands of genetic mutations within those tumours is that, yes, breast cancer isn't one disease, but it falls into 10 very discrete genetic groups. And which genetic family...
Sorry, I changed my answer to C because this is the last sentence he's saying that breast cancer falls broadly into 10 main genetic, this last line again.
And this study sort of turns all that on its head. It looked at 2,000 tumours from women in the UK and in Canada. It's the largest study of its kind. And what it found by looking at...
What was found is like, what does study prove? What was found word is important over here.
Thousands of genetic mutations within those tumours is that, yes, breast cancer isn't one disease, but it falls into 10 very discrete genetic groups. And which genetic family the breast cancer belongs to has a strong bearing on how serious that tumour might be and how well it responds to treatment. For example, one class that they've identified, which according to current tests would be grouped as, you know, quite difficult to treat, in fact only has about a 10% mortality rate after 10 years, not such a severe type of cancer. Conversely, another group that they've identified, which would have a sort of fairly positive treatment profile based on current tests, would in fact has 60% mortality after 10 years, a really nasty type of tumour. More interestingly, another new class that seems to belong to these very lucky group of women whose immune system gets involved and sort of fights their cancer for them, of particular interest to scientists. And as the report's author told us earlier, this should ensure in future that women get the right treatment for their disease.
If it's 10 diseases, it means that they will require different diagnostic procedures, they will be associated with different clinical outcomes, and they will require different treatments. And so it's a big step forward in terms of how we manage women with breast cancer and how we need to not think of it as one or two or three diseases, but a much more complex entity that will require, therefore, more tailored treatment.
More tailored, so less mastectomy, more mastectomy, less tamoxifen. I mean, how's it going to look?
Dictate how a doctor, the tools the doctor has in his arm.
Okay. Guys, any suggestions for the 38th question? Because we have listened to everything, I think answer can be A as well, if I'm not wrong. Because ultimately, when he was talking about the study, first he talked about thousands of the groups. They were talking about that there was a huge study that was conducted, but they were not talking about large studies are possible or not. Obviously, they were conducting large studies, so it was obviously possible. So B, I want to eliminate. In the C part, I want to do C as earlier I did, but broadly word was not mentioned. LY word was not there. But in the end of the conversation, he was telling that treatment is different for different conditions. Like they were talking about a treatment which has only 10% mortality rate. Then he was talking about a specific treatment that had 60% mortality rate after 10 years. Something like that was there. So if I had to do it, I would do 38 ka A. But I want to check out these two answers first because this is a very tough listening. And if I would have been alone, maybe I would have redone it, but recording and then, I have to leave it. So I really want to check the answer. But if I would have been doing it alone, I would have done it again. But according to me, 37th was an easy one. It should be B. 38th was little tricky. It can be A or C, but I want to do A, to be honest, at the end of the day. Because LY word, I could not listen to. It's only because of LY words. Otherwise, my choice is C. But let's check out the answer so that we can do it again. These two questions we will repeat, but in the final exam, the listening is going to be easier. But let's do it. Okay. 36 ka we have done. But 37 ka we have done A, B. That's fine. And 38th is A again. Both the answers are correct. I'm not saying again, it's not to tell you that I am good. It's to tell you how this effective method of elimination is. When I put my guesswork, it gives me chances to pass. Like 37B. Why? Again, let's reconsider. Please do with this method that we did instead of word 2 times. So this was eliminated. There was a word personalized medicine. So I thought that I should not do this because it says personalized care. So I did B. Then in this blank, larger study was conducted and broadly word, LY word was never spoken. So I eliminated this one. Otherwise, this was also an answer that I was thinking. But then I thought, oh, LY word has not been spoken. I don't want to do it. And I will make you re-listen just the last time because ultimately I can't tell you how to listen. But I can actually help you that LY words. And please listen in the last, they will say there are 3 kind of specific treatments. Like, this has 10% mortality rate. So just listen to it once again, then we are done with the class. Because we don't want to overdo it. It's just about learning how to do it. So let's do it again. Just
illustrate what new genetic technologies are allowing scientists to do in at diagnosis, how serious a breast tumor is. 2,000 tumors from women in the UK and in Canada. It's the largest study of its kind. And what it found by looking at thousands of genetic mutations within those.
What I found in thousands of studies was that
is that, yes, breast cancer isn't one disease, but it falls into 10 very discrete genetic groups.
So there were 2 words missing, main and broadly. Again, let's listen to this line just once more again, how to eliminate.
Breast cancer isn't one disease, but it falls into 10 very discrete genetic groups.
It falls into. So there was nothing between. Falls broadly into. Again, let's listen one more time. You will eliminate it.
And what it found by looking at thousands of genetic mutations within those tumors is that, yes, breast cancer isn't one disease, but it falls into 10 very discrete genetic groups. And which genetic family the breast cancer belongs to has a strong bearing on how serious that tumor might be and how well it responds to treatment. For example, one class that they've identified, which
one course or one clause that they have identified is
current tests would be grouped as, quite difficult to treat. In fact, only has about a 10% mortality rate after 10 years, not such a severe type of cancer. Conversely, another group that they've identified, which would have a sort of fairly positive treatment profile based on current tests, would in fact has 60% mortality after 10 years.
So positive elimination, then he was taking about treatment course can be mentioned. Again, can word was very important. As you know, can, could, may, might are my favorite words to choose the answer. Ly word is the worst option that I always eliminate according to the rules of adverb that always we have discussed in every reading and listening. So that is how I do it. Ly word out, can, could, may, might in. That is what gives me answer. And then he was talking about treatment course and options. And after the word, he said what we found. That means what did study prove? Ultimately, study whatever it proved, it was talking about some treatment course. And broadly word was never said. So I had to eliminate that. So this is how difficult questions can be managed. Again, your paper, again, I'm telling you, if I have to tell you the marks, in the part A, out of 24, 18 blanks should be easy. 2 blanks should be challenging in spellings. In part B, 4 questions would be easy because there are total 6 questions in the listening part B. Then in listening part C, out of 6 questions, 4 questions would be easy. In the listening part C ka second, again 4 questions would be easy. If you do only easy questions, right, 4 plus 4 plus 4 will make 12. And 18 marks in the part A will make it 30. You will pass. But still, if you want to do difficult questions, please apply these fundamentals of ly words to be eliminated. Can, could, may, might are our favorite words. That can be our answers. And that is how you do it. And elimination method is the best method in the part B and C. Because you cannot select what is right. You can just eliminate that he did not speak the word broadly. So you focus on the word, and as soon as he miss out the word broadly, say falls into, and the option says falls broadly into. That means there is a mismatch. You eliminate it. That is how you do it. This is Dr. Bhupesh, and please subscribe our channel And for more, just let us know how we can help you in the comment box. Thank you very much.